Hello everyone, I'm Dr. Deepak Inamdar. I'm an orthopedic trauma and joint replacement surgeon based in Bangalore, Jayanagar. I operate at Apollo Specialty Hospitals. Most of my knee and hip replacements are done there. So I am here to talk about a very important and a relevant topic for those undergoing knee replacement surgery. The most often asked question to me in my clinic, in my OPD is, Doctor, do we even need to do all the blood and other investigations before the surgery? Anyhow, it's covered in the insurance, we might as well get it on admission. Why is it required to do it before the surgery? So I am here to address this topic. Today I have a list of investigations before you and will try to address as to why each of them are required. Let's start with the investigations now. The first one is hemoglobin and PCV. As to why this is required is because you should be not anemic before admission. You should have sufficient hemoglobin. If you have a low hemoglobin, it needs to be addressed with hematinics before admission. Only when you have a sufficient hemoglobin and PCV can we do a major surgery such as knee replacement. The second thing is inflammatory markers, TC, TC, ESR and CRP. These are indicative of an inflammation or an infection going around somewhere in the body and will have a chance of getting your knee implant getting infected. Hence, it's important for these to be in the normal or near normal range. The third one are the bleeding parameters, BT, CT, PT, INR. For those who are on blood thinners, and more so now in the post-COVID era, it's very important for these to be normal. The fourth one are the renal parameters, which should be in the normal range or near normal range. Sugars, to know whether you have adequate control of sugars, especially the HbA1c will give us a very good idea regarding that. The seventh one is a COVID RT-PCR, which is very important in this time. Eighth is an ECG and echo for your heart health, knowing the state of your heart, whether you are fit enough to undergo a major surgery. The ninth, perhaps one of the most important investigation, is in urine routine micro and culture sensitivity, because this indicates whether you have a latent or an overt urinary tract infection. This has a very high chance of infecting your hip and knee implant if left untreated. This has to be treated before your admission. And 10th, right now in the COVID era, is D-dimer and CT chest. So these are the important investigation one needs to do before knee replacement surgery. Thank you.